Welcome to RAAONLINE. Today's session will be Male Internal Genital Organs. I am Dr. Rajapriya, Professor of Anatomy. At the end of this session, the learners must be able to describe the position, features, relations, blood supply, nerve supply, lymphatic drainage and clinical aspects of male pelvic viscera. And you have to explain the anatomical basis of urinary obstruction in benign prostatic hypertrophy and lobes involved in prostatic cancer. Organs of male reproductive system are classified into testes, system of ducts, accessory sex glands and supporting structures. Testes produces sperm and secretes testosterone. The system of ducts includes epididymis, ductus deferens, ejaculatory ducts and urethra. Their function is to transport and to store sperms and assist in their maturation. The accessory sex glands include seminal vesicles, prostate and bulbourethral glands. The supporting structures include scrotum and penis. Penis delivers sperm and scrotum supports testes. These are the organs of male reproductive system. Today we will deal with the male genital organs within the pelvis. Coming to ductus deferens or vas deferens. Ductus deferens is nothing but continuation of the tail of epididymis. So this is the testis. This section is actually a sagittal section of a male pelvis. This is nothing but a sagittal section of male pelvis. And here this is the anterior aspect and this is the posterior aspect and this is the testicle. On the posterior aspect of testicles, there is an epididymis. This epididymis continues upwards. Epididymis continues upwards as ductus deferens. And it joins with seminal vesicle to form ejaculatory duct, which opens into the prostate gland. So, what is vas deferens? It is nothing but the duct. In the male reproductive system, it is a continuation of the tail of epididymis at the inferior pole of testis. It has very thick muscular wall and it has minute lumen. When we palpate it, it will give a firm card-like firmness when we palpate it. And how it ends? It ends by joining with the seminal vesicle to form ejaculatory duct. And what is its course and relations in abdomen? It ascends posterior to the testis but medial to epididymis and it forms a primary component of spermatic cord. This is the spermatic cord. It forms a primary component of spermatic cord. Then it pierces the anterior abdominal wall and lies in the inguinal canal. In the inguinal canal, afterwards it crosses the external iliac vessel. This is the external iliac vessel. It crosses the external iliac vessel and enters the pelvis. And in the pelvis, it passes along the lateral wall of the pelvis, lies external to parietal peritoneum and it is in direct contact with the peritoneum. It crosses superior to ureter. This is the ureter. This is the vas deferens. It crosses superior to ureter, reaches the supralateral angle of the urinary bladder, runs between the ureter and ureteric folds to reach the base of the bladder. It reaches the base of the bladder. Now it has reached the base of the bladder. On the posterior aspect of the bladder, it dilates. First it was superior to seminal vesicle. This is a seminal vesicle. First it was superior to seminal vesicle. Then it descends medial to ureter and seminal vesicle and here it enlarges to form, the ductus enlarges to form a structure called as ampulla. And you can see this is a posterior view of the urinary bladder or the male pelvis and this is the ureter. Vas deferens is ventral. Vas deferens is always ventral to the ureter when it crosses the ureter. And after crossing the ureter, it descends medial to the ureter, descends medial to the seminal vesicle and it enlarges to form ampulla of the vas deferens. And how it ends? It ends by joining the seminal vesicle to form a duct called as ejaculatory duct which opens into the prostatic urethra. Coming to the arterial supply, see this arterial supply here. This is arterial supply. Vas deferens. Vas deferens is supplied by superior vesical artery, which in turn is a branch of internal iliac artery. This is a superior vesical artery which supplies vas deferens. With this superior vesical artery is a branch of internal iliac artery. How it ends? This ends by, this is the artery of vas deferens. It ends by anastomosing with the testicular artery. Testicular artery is a branch of abdominal aorta. So this is a branch of vas deferens. Coming to venous drainage, the terminal portion of the vein of the vas will drain into vesicular venous plexus that is close to the urinary bladder and prostatic venous plexus that is close to the prostate. But the veins from the proximal part of the ductus will drain into testicular veins through the pampaniform plexus of veins which is present on the posterior. This is the anterior aspect of testis. This is the posterior aspect of testis. On the posterior aspect of the testis, it drains into testicular vein through pampaniform plexus of veins. This is about vas deferens. Coming to the male sterilization. Permanent sterilization in male is done through vasectomy, where the testis is palpated and the spermatic cord is palpated through the skin. Incision sites are being done. This is the incision site. Incision is being done. Spermatic cord is being extracted. The firm card-like structure, that is the vas deferens is being elevated. The vas deferens is being cut and clips, vas clips are being put. This is called as vasectomy. This picture is the same. See, this is the posterior aspect of the testis, superior aspect of the scrotum, where a cut is made and clamps are being done in the vas deferens. This is the permanent male sterilization procedure.